let's talk a little bit about blepharitis. Now, blepharitis is a very common condition. In fact, I would say probably half the patients I see on a daily basis have some degree of blepharitis. But you know what? If we're going to talk about this, let's define our terms. What is blepharitis? Basically, bleph means eyelid. Well, that's pretty simple. Itis means inflammation. For example, people who have arthritis have an itis, an inflammation in their arthro, in their knee. Well, blepharitis is something similar. It's basically inflammation inside of the eyelid. Blepharitis. Very common. And what are the symptoms? Basically, if I see a patient who has a lot of eye irritation, often describing sort of a sandy, a gritty, sort of a dirty sensation to the eyes, maybe first thing in the morning there's a bunch of junk in the eye, or as the day progresses it just doesn't feel right. The eyes tend to look red and a fair amount of stinging sensation. So, what causes blepharitis? Well, the first thing is lash debris. Now, if you look at a patient who has a fair amount of blepharitis, you'll see something similar to this. At the base of every eyelash, you can see debris that has formed here, and this debris is basically buildup of dead skin cells, oily secretions, dried tears, building up on the eyelashes here. And you can imagine this debris harbors bacteria because bacteria love this type of environment, and bacteria produce endotoxins, exotoxins that irritate the skin, cause a lot of redness around here, and you can imagine this debris is constantly falling into the tear film and irritating the eye. So the first problem is tear debris, basically lash debris on the base of the lashes. All right. The next problem is something called meibomian gland dysfunction. Okay, so what are the meibomian glands? Basically, if you look at an eye under a microscope and you look at the eyelid margin, you can see little glands down here, these little white dots down here, and these glands are called the meibomian glands. Meibomian glands produce oil, and that oil is basically squirted, it's secreted into our tear film up here, and that oil keeps the tears nice and well lubricated, and they keep the tears from evaporating too quickly. Now, every once in a while, you'll find someone who has blocked meibomian glands. You can see this gland right here is blocked, and these glands here are blocked. Normally, when you press on the eyelid like this, clear oil comes out, but here it's coming out more like toothpaste. This oil is of poor quality. These glands are getting blocked up, and so the eye is constantly irritated because it's not getting enough of that nutrient oil, and so the quality of the tears is affected. So, basically, these glands are getting clogged up. So blepharitis is caused by a combination of debris in the base of the lashes and clogged meibomian glands, and between the two of those, the eyes are very irritated. So how do we treat it? Well, warm compresses is probably the first step. Basically, take a washcloth, run it under some hot water, and lay it over the eyes, and just take a little sauna. That warm water will get that debris to come off the lashes, and will also allow these oil glands to dilate and start flowing better. Now, if that doesn't work, the next step I usually recommend is lid scrubs. Basically, once or twice a day, take a washcloth, a little bit of Johnson & Johnson's baby shampoo, get that washcloth kind of sudsy, close your eyes, you don't want to get soap in your eyes, and very gently massage along your eyelids. Combination of warm water, a little bit of soap, and that massage action will get that debris off the lashes, allow these glands to open up and start flowing better, and hopefully make you feel better. Now, if that doesn't work, the next step I usually tell people is try supplements. Things like flaxseed oil, you can get this at nutrition stores, can sometimes change the oil consistency of your body and make your eyes feel better. And if that doesn't work, then you really need to see your eye doctor, and we can try a couple of different things. One of them would be a topical antibiotic ointment to put on your eyes at bedtime. And if that doesn't work, possibly an oral antibiotic called doxycycline that can sometimes be of help. So blepharitis, basically inflammation of the eye. It's a little bit of a catch-all term, but a lot of people suffer from it. Very difficult.
For more informative videos like this, visit us at tomokaeye.com. Or if you would like to make an appointment to see one of our doctors, please call 386-672-4244.